The doctor is in, and today's pediatrician, Dr. Robert Wittrock from Ascension St. John Pediatric in Adolescent Medicine. And today we're talking about the baby formula shortage that's happening around the country and what parents can do about it. Dr. Wittrock, good to see you.
Thanks for having me on.
A lot of people at home may be dealing with this, or if they're not, they know somebody that's dealing with this. Tell me about this baby formula shortage. It's been a few months now, or longer than that even.
Right, it's getting to be a big deal, and it's really sad that we're in this situation in the first place. Why it's happening, it's essentially complicated. I mean, there was a big formula recall with one of the brands, inflation, kind of a panic going on about it, sometimes supply chains, you know, the usual things that get blamed these days for stuff. Either way, we're in this situation, we want to make sure that babies are getting fed. So there's some very important things to remember. A lot of babies like certain brands. I like to say that a lot of these brands are kind of like Coke and Pepsi. They all have their own forms of certain things with the small, minor differences in taste. So all the brands have the proper nutrition that babies need. So if you need to change to a different formula, talk to your pediatrician or just go for it. Things to keep in mind, don't use animal milk or homemade, like I'm talking animal milk and just like right out of the jug, or homemade formulas. Those don't have the right kind of calories or vitamins that babies need to grow. Don't dilute the formula to make it stretch longer. I've seen some babies have seizures from this because they get too much water and their sodium drops out. If you're looking for formula and you don't know where to turn to, call your pediatrician. They keep their fingers on the pulse of what's going on, or call Emergency Infant Services or the WIC office. Typically, those are the good places I like for people to contact.
And off-brands, you know, so a lot of people want to buy the name brand formula, but off-brands are just as good too, right? Most of the time.
Yeah, so usually at like the big box stores, they've got their own form of that kind of formula. You know, you kind of look at it and they'll say on the label, oh, similar to Similac or Enfamil or whatever it is. But that's the main things that I really want people to remember, just to make sure that babies grow in like a healthy manner.
Yeah, the important thing is don't just stop using formula. You got to use it. And how important is it for, you know, an infant and a baby?
Right. So pretty much up until about 4 to 6 months of age, it's either breast milk or formula, and that's it. Afterwards, you start introducing foods, and then by the time they're a year, you're transitioning from formula over to whole cow's milk, typically.
Cool. And so the 12 months is when you want to transition to whole milk. Exactly.
Now, I will say one caveat. There are some specialized formulas like Alimentum, Nutramigen, that are for our babies with milk protein allergy. Those I don't want to be exchanged with other kinds of formulas. Reach out to your pediatrician and they'll help you guide through that situation.
Okay, I bet you're getting a lot of questions about this.
A lot of questions, yeah.
Very helpful. All right, Dr. Wittrock, thank you so much. We appreciate it.